Hello. This February marks the 51st observation of Black History Month. And, like the past 50 years before, we are turning our focus on the Black community as we pay homage to the heroism, achievements, advancements, challenges, and obstacles that members of the Black community face. Those of us who specialize in HIV care are particularly focused on the impact HIV continues to have on Black Texans and the deepening burden of disparities and disproportionalities members of the Black community experience. Black women and Black gay, bisexual, and other men who have sex with men are two of the 5 Texas HIV priority populations. Black MSMs bear a 20% burden of HIV compared to white MSMs who bear a 14% burden of the diagnosis. Black women have a 7% burden of HIV, while their white counterparts are not considered as a priority group for this diagnosis. 7 out of 10 people who are living with HIV in Texas are Black or Hispanic. And remarkably, overall, our data shows Black Texans have rates that are 3 to 13 times higher than their counterparts. In short, Black Texans are disproportionately affected by HIV. Many in our community are uninsured or underinsured. Some lack connections with healthcare providers. And we're all faced with the unrelenting stigma of HIV. Routine HIV screening has proven to be the most efficient, non-stigmatized method of screening and linking people to care. Emergency departments across the country and some in Texas have effectively screened and linked numerous individuals to medical care. They are providers of health services to patients, regardless of age, race, gender, sexual identity, or ability to pay, and reflect the importance of making routine HIV screening a policy-driven directive for all patients who access healthcare. The disparities that the Black community face in healthcare makes it imperative for more emergency departments to embrace routine HIV screening as a standard of care, particularly as job loss and illness from the COVID-19 pandemic are driving more people into hospitals for medical services. Primary care and specialty providers also have a role to play in addressing HIV by including routine HIV screening as a normal aspect of care for all patients. The 2006 CDC recommendation to routinely screen patients who are 13 to 65 years old is supported by the 2019 United States Preventative Services Task Force Grade A recommendation for routine HIV screening of adolescents and adults 15 to 65 years old. This means all patients 15 and older who access healthcare should receive an HIV screen regardless of race, gender, sexual identity, or perceived risk of being diagnosed with HIV. The Achieving Together Plan and the Federal Initiative to End HIV reflects the International Ending the Epidemic Plan to test 90% of the population, ensure 90% of those who test receive their diagnosis and are on ART, ensure 90% of those who are on ART or antiretroviral therapy are virally suppressed, thus decreasing new infections by 50%. Our 90-90-90-50 goal may seem insurmountable, but with purpose-driven unity, we can make a difference on the impact HIV has on Black Texans. We have come a long way, and we have much farther to go. We must test from a status-neutral position and use every opportunity to educate and link our patients to care for prevention that includes PrEP or treatment to achieve viral suppression. Additionally, we must overcome stigma and address HIV like the chronic disease that it is. Our language must put people first, and our care teams must be multidisciplinary and culturally responsive. Texas is a national leader in politics, science, industry, commerce, education, and sports. We're also the first southern state with a plan to end HIV. Together, we must channel the pioneering, trailblazing spirit of Black Texans like Juanita Craft, Bessie Coleman, Barbara Jordan, Mickey Leland, and Doris Miller to expand routine testing and care, end stigma, and decrease new cases of HIV. We are standing on broad shoulders. The time is right and our moment is now. We must end HIV together.